Okay, so I'm walking towards one of our members' homes, and she has a grocery shopper. She gets ride to the doctor, and I believe she also has a friendly visitor. And she's a really cool lady, but she definitely needs a lot of help accessing and getting the social supports that she needs to get better health care. So come on, let's go visit her.
It's wonderful, they'll take you to the doctor. If you need to go to the bank or grocery store, there's somebody that can give you a ride, and it's not going to cost you anything. So I needed somebody to talk to.
Mm-hmm.
Kathy came into my life, and she's more fun than anybody I've ever known. Kathy has 2 sons. I have 4. We have a lot to talk about. And she's the fastest person at making a bed, hanging up clothes, that sort of thing.
Good.
I have trouble reaching up with my right hand, and it's hard for me to stand. That's something I really appreciate about ElderHelp. The ladies that are driving. I have trouble with the seat belt, and going up a curb is almost impossible, so they'll offer an arm. One lady is Gina. She's already got a degree, and she's going to be a social worker. And I know I have to look to the fact that they're doing it for a certain length of time. And she and I like movies.
That's awesome.
So we go to movies frequently, and we pick them. She usually picks them ahead of time, or I'll mention something I like. She took me to see The Help, although she had seen it already. And we have popcorn, and I feel like a teenager again.
So do you think ElderHelp has...
Near the first, I needed to go to the bank. We'd been to the doctor, and he stopped at the store, took me in, and I shopped. And anything that didn't look right about diabetic food, good for me, he would put back. And so I only got good stuff. And I think it's wonderful. I think it helps someone like me stay out of a hospital. Elder care gives me people that are kind and gentle and make me feel like they care, and I believe they do.
Okay, so that was Jerry. She's really cool. I really like her. She was, she just worked so many jobs. She's a paralegal and a journalist, and had a little showbiz kind of going on in her early years. So I think that when we look at innovation and we look at our ability to bring these services to people, mobilize a workforce that's desperately needed from the assets that are here in the community, and we do it in a coordinated way to bring those social supports to bring better health and health care to people. And that's what ElderHelp does.